Hi, Vitaly Mikrikov here. I'm a PhD in medicine. We continue the model on chemical removers. The topic of this lecture is tactics of choosing methods of laser or chemical removal of permanent makeup or tattoo. After the lecture you will find a quiz on this topic. Let's get right into it. Now let's discuss the tactics of choosing a tattoo and permanent makeup removal methods and what principles should be followed when deciding to remove in a particular case with a laser or a chemical remover. This is important because often the permanent makeup masters do not know what principles to follow when deciding on the choice of removal method, and because of this they make mistakes that leads to both poor removal efficiency and high risk of complications. Indications for one method will be contraindications for another. I prefer laser removal as a method with wider indications and lower risks, of course with adequate use and understanding of methods for safe and effective work, because laser for tattoo removal also belong to the highest hazard class 4. The indication for laser removal will be any, I emphasize any, black and red tattoos if you have a neodymium laser. Any warm and cold colors, brown, gray, red, orange, will be an indication for laser removal of permanent makeup. A contraindication to laser removal is yellow, white, flesh-colored, as they are more likely to undergo the effect of paradoxical darkening, and this will complicate their further removal. If you have the Picosure Alexandrite laser in your arsenal, then your indications expand to tattoos and permanent makeup of green and blue colors. Indications for using the remover. Tattoo removal when laser removal is ineffective. I mean that you do not have a laser with suitable wavelengths in your arsenal. For example, the rest of the tattoo is green, but you do not have an Alexandrite laser, and the patient does not have the opportunity to receive a procedure on such a laser from a good specialist. If you are talking about standard colors, red, black for a neodymium laser, and after several effective procedures the fading process stopped, this is just a signal that more powerful equipment needs to be used, for example a stationary laser, and if it is ineffective, a picosecond neodymium laser. Removal of residual yellow or orange tattoo. The situation when after several sessions of laser removal a yellow pigment remained, which was originally part of the ink as one of the main components. Such a pigment is extremely difficult to destroy even with expensive laser devices, since it very poorly absorbs the working wavelengths of all lasers for removing tattoos and permanent makeup. The same recommendations apply to the white pigment, which is sometimes used for camouflage. A relative contraindication to the use of chemical removers. I would call their use on the skin of the body due to the lower intensity of blood flow and lower ability to regenerate, in contrast to the skin of the face, where even more severe injuries can successfully heal without scarring. I would also include a large area of simultaneous removal as contraindication. This significantly increases the risk of complications in the form of scars. We discussed the indications and contraindications for the use of laser and chemical tattoo and permanent makeup removal methods. In fact, this is the tactics of their application and reasonable choice. I would like to make a few more accents in order to form a complete picture for you. If the patient's situation combines indications for the use of both a laser and a chemical remover in different areas, then these methods should be applied to this corresponding area of the skin and separate them in time of the areas are in close proximity so as not to build up inflammation and reduce risk. I am strongly against situations when, for unclear reasons, specialists combine a laser removal and a chemical remover in one procedure on the same skin area and declare that this increases efficiency, forgetting to mention that the risk of complications due to the combination of mechanical, chemical and laser trauma. Another tactical situation. During the removal process the indications changed. You removed everything that could be removed with your laser, and now the patient has a bright yellow residue on which the laser is not effective. In such a situation, you change the removal method from laser to chemical and bring it to the final cleansing of the skin at the desired level. My students have had success with these tactics. And one more simple principle, but it needs to be said. If you have only one of the removal methods in your arsenal, only a laser or only a remover, and the patient has indication for another removal method, you do not need to use the one that you have in return for the one that is missing. Refer the patient to another specialist who has the correct removal method. No need to use the method when it is not effective or even contraindicated, simply because you do not want to lose a client. Prioritize the health of your patients. This will help you earn a good reputation and attract even more customers. Tooth removal is not a sprint, it's a marathon. And first of all, you need to think not about the speed of removal, but about the safety of the patient. If you do it slowly and well, then people will forget that you did it slowly and remember what you did well. And if you do it quickly but badly, then people will forget what you did quickly and remember what you did badly. For example, you left a scar on the patient's skin for the rest of his life. Do not harm, the main principle of medicine, and it is more than suitable for tattoo removal and permanent makeup removal with lasers and removers. See you in the next lecture. I've been Vitaly Mikryukov, and as always, thanks for listening.